Thank you, Dr. Sabha. And the title of my talk is Glycemic Control for Effective Diabetes Management. This is one of the dietary approach. Next, please. How we can use various type of dietary intervention to get rid of, to control diabetes. Like that. Here. First of all, and it is a multifaceted. The diabetes have various sides. It is type 2, type 1, and gestational diabetes. I think you people are aware of that. And then, if you can see the data all over the world, 537 million people are the serious victim of diabetes. And in 2030, the data is, if you can cascade the data into 2030, we are expecting more than 643 million people. So you can imagine the horrible situation on the globe. If you can see that in addition to diabetes itself is a complication, but it is also hooked on or allied with other complications like nephropathy, like retinopathy, cardiovascular disorders, and chronic hyperglycemia leads to oxidative stress also. Next please. If you can, I just want to share the data. In Pakistan, the situation in Pakistan is extremely pathetic. It is alarming, and we are, I think, right now number 1 all over the world in diabetes. And according to the International Diabetes Federation 2021 data, our people, about 27 or 28% people are diabetic. So, and the rate is increasing day by day because of the certain reasons. I want to discuss the reasons. One of the reasons is the poor dietary lifestyles and lack of exercise and lack of physical activities. So we are on the top, and in addition to the diabetes, about 11 million people in Pakistan are impaired glucose tolerance, so they are also prone and shifted toward diabetes in the later stage. How is the glucose homeostasis going on? There are 2 routes. If there is a high blood glucose level, what happens? And if there is a low blood glucose level, what should the pancreas will do? So if the blood glucose level is higher, the pancreas works and it secretes the hormone, that is insulin, by the beta cells, and by the release of insulin, we are managing the glucose level, and it is transported to the our blood and muscle cells and fat cells, and automatically the glucose level in the blood become normalized. While on the other hand, when the blood glucose level is on the lower side, in the blood, the glucagon, which is one of the secretion of alpha cells of the pancreas, it is glucogenolysis, process of glucogenolysis, that the glycogen which is stored, the glucose which is stored in the form of glycogen in the liver, it breaks up and glucose is released, and then what it does, that it enhances the glucose level in the blood to maintain the glucose homeostasis. So these are the 2 main routes. And what are the causes of diabetes? Genetic disposition, that there is also genetic complications. There is a sort of hereditary diseases in the families. This is present in the family's history also. Then socioeconomic factor is one of the pivotal factors. Some people which are really poor, they just rely on carbs. तो कार्ब की वजह से आप उसको प्रोटीन प्रॉपर, they don't have a proper access to protein, or they don't have a proper access to the balanced diet, and due to the reason they are more prone toward diabetes. Likewise, dietary habits, as you know that now the youth and the younger generation are shifted towards the junk foods like pizzas and pastries and shawarma, something like that. And I think they don't have 0 calories even, because they are just having a lot of carbohydrates in their diet, and the fat is not even healthy, the present in that. Then lack of awareness and education is one of the main factors, and I think the Park Korea Nutrition Center is also one of the attempt to create awareness in the frontline workers. We are working on that. The Faisalabad Medical University is also working on it for the capacity building and training of ladies health workers, the school teachers and the nutritionists, diabetic and health professionals. And the core agenda is to enhance the awareness and for the capacity building of these frontline team. Then lifestyle changes, I already mentioned you, and overall these factors leads to diabetes. In the various risk factor, I just want to share with that the various risk factor which in the later stage leads to early onset of type 2 diabetes. For example, if you can see in the center, less exercise or activity, if we have not access to proper exercise, high calories intake, what it leads to, we have obesity and the people become obese. And I think you know very well that obesity is one of the reasons of diabetes, and one of the data in United States has been shared that about 80% diabetic people are obese, are overweight. And this is the basic lacuna in our Pakistani public, that we are lacking in physical activities. मिसाल के तौर पे हमारा जो एजेंडा होता है पाकिस्तानियों का, मैं अब सारे लोगों को नहीं बात कर रहा, तो पीपल आर बहुत समझदार भी है बीच में, ये होता है कि खाना शाना अच्छा हो, काम ना करना पड़े। तो अगर आप बाहर जाते हैं तो आप देखेंगे वहाँ ख़वातीन भी बहुत सी वॉक कर रही हैं, एक्सरसाइज कर रही हैं, ब्रिस्किंग वॉक हो रही है, भाग रहे हैं लोग, उन्होंने वो कानों में लगाए हुए और लगे हुए घंटा डेढ़ घंटा एक्सरसाइज कर रहे हैं। हमारे ये कंसेप्ट ही नहीं है। उसकी वजह नहीं, एक तो हमारे पास फैसिलिटीज़ की भी कमी है, बट एट द सेम टाइम वी डोंट हैव अ माइंड सेट, हम ये करना ही नहीं चाह रहे होते। तो ये मेरा आप लोगों से, मैं इसलिए अपने लोकल लैंग्वेज में बात करूँगा, तो चीज़ें आपके लिए बड़े इजी वे में कन्वे की जाए कि आप एक्सरसाइज को अपना एक बनाना चाहिए, रूटीन में लेना चाहिए, और साथ जो हमारी डाइट है वो बड़ी बैलेंस्ड होनी चाहिए। सो द complication of diabetes, there are various eye disorders. Sometimes the people are even blind in the later stage. Then heart attacks, peripheral neuropathy, then cerebrovascular diseases, mental disease, then permanent kidney damage. I think you guys are familiar that those of the people which are in the later stage, their kidneys become malfunctioning, and diabetic foot infections ये लोगों के पाँव में अक्सर हो जाता है। Next is the why glycemic controls matters, prevention of complications. The good glycemic control reduces the risk of, अगर हम glycemic control को properly manage करते हैं तो हमारी जो complications जो हैं वो kidney disease है, आपके neuropathy है, retinopathy, आँखों के मसाइल हैं, we can control that. Then cardiovascular health, we can prevent the cardiovascular diseases, improve the life quality. तो हमारे fatigue, blood weaken नहीं होती, frequent infection नहीं होएगा, and overall we can say we are reducing the mortality rate, which is also one of the agenda of the nutritionals and health professionals, that we can reduce the mortality rate. When we are working on these issues, it also reduces the healthcare cost, and not of the people but also the healthcare cost. The government has to invest less on the healthcare cost, which is also one of the big burden on the government side. The next is it enhances the mood healing, support for the mental health. Next please. Dietary approaches to the management. What are the dietary approaches which we are used to manage diabetes? Glycemic control diet is mainly characterized by eating healthy foods. Healthy food means those food which have low glycemic index, and in this context we generally rely on complex carbohydrates, and we are avoiding the instant source of glucose. then particularly for the diabetics, and the carbohydrate quality and quantity is very effective. The carbohydrate counting allows precise control of glucose intake. Research supports low GI foods and moderate carb diet for stable glucose level. I already mentioned you that we should rely more on complex carbohydrates and less on the instant source of sugars like various sodas, something like that. It is recommended for the diabetic patient to prioritize the whole and minimally processed foods. जो डायबिटिक पीपल हैं उनको होल फूड पे आना चाहिए ताकि उनको ब्रान ज़्यादा मिले. तो ब्रान के अंदर जो फाइबर है वो कम्प्लेक्स फॉर्म में है विच इज़ हेल्पफुल. तो उसकी डाइजेशन इट टेक्स मोर टाइम फॉर डाइजेशन एंड इट कंट्रोल्स वी कैन मैनेज द ग्लूकोज लेवल. बिसाइड हेल्थी फैट्स हमें सैचुरेटेड फैट से अवॉइड करना है. लीन प्रोटीन को यूज़ करें. Managing the nutrient intake may improve glucose control. Portion size is very important. If you are taking healthy diabetes and you are taking a big portion size, this is also one of the issues. So portion size is also very important. In addition to the portion size, the regular meals is also important, which is the preferred form rather than you can take a meal. बार बार आप खुराक खाएं वो अच्छी बात है. You have to take proper intervals. And limiting the salts also. हम सोडियम क्लोराइड जो साल्ट है इसको बहुत यूज़ करते हैं. ये भी एक वन ऑफ द फैक्टर है. तो healthy plate and glycemic index, this is for the diabetics, not for the normal person. For the diabetics, the diabetic they will take complex carbohydrates, polysaccharides, then protein foods, particularly the fish, and then non-starchy vegetables, those which are the instant like potato है, ये starchy food है, फ़ौरन ये हमें ग्लूकोज देता है. तो हमें complex carbohydrate non-starchy vegetable पे जाना है. On the other hand, I am just sharing you the glycemic index foods. What are the high glycemic index foods, low, and then the medium size. फिजिकल एक्टिविटी फॉर द ग्लाइसेमिक इंडेक्स टाइप ऑफ एक्सरसाइज जो एरोबिक एक्सरसाइज हैं जैसे ब्रिस्किंग है, डांसिंग है, बाइसिकलिंग है, साइकिलिंग है. इट इनहेंस इंसुलिन सेंसिटिविटी. तो जब इंसुलिन सेंसिटिविटी बेहतर होती है तो हमारा ग्लूकोज लेवल जो है वो उसकी अपटेक जो है वो बेहतर इम्प्रूव हो जाता है. इंसुलिन रेजिस्टेंस कम होता है. तो एक्सरसाइज रेगुलर एक्सरसाइज इज वेरी इंपॉर्टेंट. Then the mechanistic inside exercise improves the glucose control to increase GLUT4 transportation. GLUT4 is one of the carrier for the transport of glucose to the adipocytes or adipose tissues to the muscle, something like that. So in the nutshell, you can say that exercise, particularly the aerobic exercise, are very important. Then lifestyle adjustment, the chronic stress जो है वो एलिवेट कार्टिसोल्स. तो हमें स्ट्रेस मैनेज करना होता है इसमें डायबिटिक के अंदर. तो जब स्ट्रेस आता है तो कार्टिसोल रिलीज होता है. पर्टिकुलरली हमें एडिक्वेट स्लीप जो है वो दिस इज वेरी इंपॉर्टेंट बिकॉज एडिक्वेट स्लीप लोअर द इंसुलिन रेजिस्टेंस, लेस कार्टिसोल इज सिक्रेटेड एंड इट लिंक्स विद द स्लीप डेप्रिवेशन टू. और इसमें HbA1c का लेवल भी देखा गया रिसर्च में कि HbA1c का लेवल कम होता है इफ़ यू हैव ए हेल्थी लाइफस्टाइल. So last slide conclusions. Prioritizing glycemic control is fundamental step towards healthier lifestyle for individuals with diabetes. Stable blood glucose level help to prevent immediate and long-term complications. Effective glycemic controls, which is the take-home message today. It is the effective glycemic control enhances the life quality and mental well-being, reduces the risk of interlinked complication of cardiovascular, kidney, nerve and eye complications, and it supports the healthy aging. Aging को हम रोक नहीं सकते हैं, we cannot stop aging, लेकिन हम उसको linger on कर सकते हैं. तो हमने aging को healthy way से गुजारना है. ये एक and last but empowering the diabetics through education,
लाइफस्टाइल एडजस्टमेंट, अर्ली डायग्नोसिस इज वेरी इंपॉर्टेंट, अर्ली डायग्नोस करें जो कि हमारे एक इशू है, एंड रेगुलर मॉनिटरिंग लीड्स टू बेटर हेल्थ आउटकम्स, एंड थैंक यू वेरी मच.
Thank you very much once again on the behalf of University of Agriculture, Faisalabad, for inviting us and our participation in this event. Thank you.